Good morning. It's Thursday, October 13th. I'm Jessica Lovell. Coming up today on the Morning Medical Update. Bipolar disorder and depression. Certainly nothing to sing about, except perhaps in a powerful musical involving at least one health system nurse who credits the production for charting her career path. We'll talk to her in just a moment. And forget the shots. One Missouri university hopes to bring a nasal vaccine to the U.S. Doc Hawk talks about the impact this could have on getting and keeping people vaccinated. And skip the junk food binge. Music may hold the power for true stress relief. That's all coming up next on the Morning Medical Update. Thank you for joining us here on Facebook, YouTube, and on Twitter. We are live here inside the Dolph C. Simons Jr. Family Broadcast Studio. Make sure you get your questions sent into us through the links here on your screen, or of course you can put those in the chat thread below. The number sounds alarming. 90% of adults say mental health is a crisis in the United States. According to a new CNN poll, half of those surveyed said they or a loved one had experienced a mental health problem that needed treating. But a Tony Award-winning Broadway musical shines the spotlight on the current national mental health crisis.
You don't know what it's like to feel that way.
It's called Next to Normal, and it centers on a suburban mother dealing with her worsening bipolar disorder and the effects it has on her family. It also examines the tough topics of suicide, drug abuse, and depression. Now, a local mental health nurse is bringing this important musical message right here to Kansas City. And she's joining us here in studio with us. Registered behavioral health nurse Tiffany Schweigert joins us today. Good morning. How are you?
Good morning. Good.
Always good to see you. And director of our behavioral health program, Lauren Lucht. How are you?
Good morning. Thanks for having me.
Tiffany, I was told that when you thought about a career in theater back in the day, that 10 years ago it was this musical that later helped shape your career in mental health care. True? Tell us about that.
Yeah. So I directed and produced Next to Normal here in Kansas City 10 years ago. At that point, nursing career wasn't really anything I had looked forward in my future. But this show struck a chord. It's really important. It was certainly important 10 years ago, and it's even more vital today. But yeah, to work with this population of individuals is very special.
Well, and you touched on it, and here's some video of your crew rehearsing and getting ready for the performance coming up here shortly. We're going to give dates to that in just a minute. But Tiffany, you mentioned it, why is it so important now more than ever that this particular message and musical get in front of people?
Yeah, with the pandemic being so forefront in everyone's mind, and hopefully we're getting the other side of COVID-19 and what all that entails. Throughout it, we were really focused on our physical health and being vaccinated and taking care of ourselves. And now, I work at Strawberry Hill. We're seeing a lot of our patients come in with the after effects of that, their mental health. And I hope that people come and see this performance and see that the normalization of mental health and how we all struggle with mental health, and sadly maybe the pandemic was the catalyst of us all realizing in our everyday lives that me too, maybe I also struggle with this. We're just all one trauma, one moment away from
such a true statement.
Yeah.
We're all a moment away, and we all know somebody. It's starting to creep in and get closer.
Yep.
If it's not affecting you directly. How are the actors relating to some of these characters in the story?
Yeah, so I have a cast of just 6, and it's primarily a family, and then there's a doctor that plays multiple psychiatrists, and then a young man that plays the boyfriend of the daughter. And it's been a very intense, it's been a short process, but intense process, just talking about not only their character development, but just their individual struggles how they have dealt with their own mental or physical health, and how that can relate and pull in to their character. My lead actress, Ashley Young, she struggles with MS, and so that's a chronic illness she has to live with every single day. And we want to normalize mental health, and it's just like diabetes or hypertension, where we got to take our medications every day, and something we live with every single day, and how it affects us. So my cast is really trying to hone in on that, and how we can, again, normalize their disease process.
Lauren, you said that we are on the great frontier and that maybe in a couple of 100 years we'll get there. We're just not quite there yet. What excites you about where we're heading when it comes to mental health research?
Well, I'm hopeful it won't take us the full 200 years,
Okay.
but I really believe that a big part of the stigma around mental and behavioral health and reaching out for help has been that it's kind of an invisible illness. And so it's very easy to consider that, or to start to think, well, it's just in my head. We've had times in medicine where we might have thought that 100 years ago. And so what we know is that it's not just in anyone's head. There are biological and genetic and hormonal and other neurotropic things that are happening in our brains that we know cause mental illness. And so it's just so important. It is physical illness. We just can't see it yet. It doesn't show up on an X-ray, but it's real. And I think that that's a huge part of taking the stigma away. I can't see it, that I'm not in a cast. No one can tell that I'm suffering, but they still are. And I agree. The catalytic part of the pandemic has been people are putting it on social media that they're not okay. And so everyone's going,
Me too.
oh, wait, I wasn't just effective. We're all struggling. We all have mental health.
It's
We all
brought us
need
together.
mental health, and we all need to practice being good to ourselves and do good coping skills to manage that.
And you said, 100 years ago, and now here we are 100 years later, we know different things. And just like with cancer research or any research in any other area, is it changing and evolving?
It is. We know that there are viruses that bring on certain mental illnesses. And imagine how many viruses we don't know yet cause things. There's been viruses that have been associated with with people becoming schizophrenic. Imagine what we'll know when we're into genomics to the level where we can know what's in your DNA, combine that with what you may have been exposed to virally, and really prevent things from happening, or at least getting patients into a good place before those things start to impact them. Prevention.
We talked about stigma, Tiffany. We're making strides surrounding the stigma of mental health, but we certainly have a ways to go. But what areas do you think right now, just what you're hearing in the communities and with patients and out in the theater community and just being out there, what are you hearing that we should be focusing on right now? What stands out to you?
Yeah, I mean, I think the numbers of suicide and attempted suicide is alarming, especially in the younger population and the LGBTQ population. So I think that we need to hone in with our young people to depression and anxiety, and this happens. It doesn't just happen once you get old, like me. It can happen at any age, and so I'm a parent, and so my children are young, and I'm just going to make sure that I give them the tools that they need to feel those things, and I'm going to allow them to feel those things. We're not going to just sweep it under the rug like we all did for so many years. But the more we talk about it, the more we normalize it, and we can all come together as a society, then the stigma hopefully will just go away. And we will all feel comfortable going to our doctors to get the medication, the therapy, all these elements that we need to be better.
Yeah, the checkups, just like we do every year.
Yep.
Lauren, we've talked about how the open dialogues have helped, and Tiffany mentioned it, but how do you think that has been helpful in overcoming the stigmas, that we try to just move down the line as much as we can?
Well, yeah, exactly what was just said. So continuing to talk about it, keep those lines of communication open, filling our every future generation that hasn't had it, but up with those tools that we know we're going to need to get through and manage ups and downs. That life is going to be filled with things, and that are traumatic, that are cause a need for you to have some mental health support. And so my comment would really be, if it's interfering with your daily life, if there's something you want to do and you can't, no matter what that is, and it's because of just something inside makes you feel like it's not right, you're scared, you're anxious, you're depressed, it's not as fun as it used to be, those are the times we want you to reach out, right? That don't wait until it's any worse than that. If something's holding you back, reach out and let's get help before it gets bad enough that you feel like there's so much stigma that you're too scared to then reach out. So,
Tiffany, without giving too much away about Next to Normal, this centers around a family, and we know that when it comes to mental health, it takes the support, whether your family is your coworkers or your friends or, it doesn't matter. It's your support group. So talk to us a little bit about how that's managed in this and how this particular musical is helping to dive into some of those deeper issues. And it centers around a mother, and as a mother, as all of us as mothers, we know sometimes we get to that breaking point. And so tell us a little bit about that.
Yeah, so it's a family, a mother, a father, a daughter, and a son, and I'm not going to give away too much, but there is a trauma within the family, and the mother suffers from bipolar, and that kind of, she's going through her manic moments, and she's going through, there's a whole scene of all the medications we've tried and they're not working, and then they actually try ECT treatment. So obviously we dramatize it a little bit because it is a musical, but just it talks about ECT and the effects that can have on someone with major depressive disorder.
Tell people what ECT is.
Electric convulsive therapy.
Okay,
so they still do that, yeah.
They do still do this?
They still do this.
In what realm?
We do it here at KU.
We do.
Tell us about it a little bit, because I think some people might, if you haven't heard of that, I mean, we do think of medication, so tell us.
ECT is absolutely a life-saving treatment for patients in catatonic states. It's also been shown to be very, very helpful for patients who are struggling with treatment-resistant depression. And so, like different forms of neuromodulation like TMS or other procedures, and this is where I get really excited about where mental health is going, because I think we're going to continue to create and develop and identify additional interventions that are very helpful.
So, who would be a good person for ECT? You said that it would be somebody who is resistant, but how does it actually physically work?
Well, and resistant, I don't mean as a human. I mean that their depression is not responding
physically
to the
resistant. Correct.
Yes,
that's what I mean.
Their depression is not responding well to our other treatments. And the next line of after we've tried from a pharmacology standpoint, we might look at adding a course of ECT into that therapy, and it's effective
to good results. To good results.
Yes.
But that's what we talk about. Mental health care, all sorts of health, cancer care. It's not one size fits all.
Right.
It's trying to diagnose what specifically is going on with each individual. I want to put some information up though, because Tiffany was talking about Next to Normal. There it is. Tell everyone where they can check it out. By the way.
Yeah. So if you're Kansas City and like myself and lived in Johnson County, the old King Louis space on
I used to bowl there, girl.
Yeah.
I did. Ice skating, bowling, yes.
Ice skating.
Ice skating, bowling. So Johnson County it's now the Johnson County Arts and Heritage Center. They've done a great job with the building. It's a really special space. But there is a black box theater in that space. And so that is where it's at. So it's right off of Metcalf. The Barn Players are the theater company that is producing it. We open next Friday, the 21st, and there's like 8 performances. So we're really excited to show Kansas City this beautiful Bring Tissues, but it's really important. It's a great show. The cast is just ridiculously talented, so I'm just thrilled.
We're excited to see what you do with it.
Yeah.
We're going to keep talking, but I want to get to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control, joining us with our COVID numbers. Good morning to you.
Yeah, it sounds real fun to get out there and a nice evening. So for right now in the health system, our numbers are still staying low for active infections. We have 19 active infections, with 1 in the ICU and 0 on the ventilator. We still have 22 additional in that recovery period, but overall, it is good to see that the last couple days our active infection numbers have continued to decrease. So I think overall it's good. We're just kind of waiting for any possible surge that maybe come in the next few weeks, maybe with SARS-CoV-2, but also, of course, influenza.
All right, Dr. Hawkinson, a nasal vaccine for COVID-19 based on technology developed at Washington University in St. Louis is on the path to becoming available in the U.S., Europe, and Japan. What else do we know about that?
Yeah, I mean, it looks like it was originally, there were some agreements made for initial development and testing in India. Again, it was from researchers at WashU in St. Louis. Looks like it's an adenoviral vector vaccine, kind of similar to what Johnson & Johnson uses as far as the adenovirus vector, but it is intranasal, and what they're really looking for and hoping for is that it induces more of that mucosal immunity, that immunity in your respiratory tract to help block infection even better. So certainly any new things that we have in our armamentarium to help prevent disease is going to be good. If this also helps prevent infection, it will be very good. But also remember, some people do have a fear of needles, and so this will help take that out of the equation as well.
Okay, a new strain of COVID called XBB. It's being called the most immune evasive yet, meaning it has the greatest ability to evade antibody protections among newly emerging variants. It's having a big impact in Bangladesh and in Singapore. Would we need to worry about that here?
Well, I mean, I think eventually. However, I think we just have to go back to the variant itself, and we continue to hear this variant is more evasive than the last. It's more easily transmissible than the last. We keep hearing that. I really think what we need to do is focus on what are the clinical aspects of these variants. And right now, really all of the variants have proven to be similar as far as causing clinical disease. Delta was maybe a little bit more severe or having higher risk of severe disease, but all the other variants are very similar. So until we see evidence and data to support the fact that one variant is causing more severe disease than the other, or we see data that that supports the fact that our T cell immunity, and again, that is our major immunity that helps prevent hospitalization and severe disease, that those variants are able to evade that immunity, I think we should be concerned at that point. But right now, I wouldn't be too concerned. Certainly, we need to continue to investigate and ask those questions. But I think this is just kind of one more story that we have been seeing since the beginning of the pandemic, and we just keep doing that. Again, keep everybody up to date with their vaccines. We know they continue to work very well, but also we need to keep doing those investigations and those studies to look at exactly what is going on with those specific variants and how they interact with our body.
Doc Hawk, thanks so much.
Yeah.
Let's see if we have any reporters on the line today. Well, let's get to our community. All right, let's get to Lucinda. She says, I have a theater background, and this is a pretty heavy topic. What have rehearsals been like, Tiffany? You mentioned it a little bit earlier, but just kind of take us inside when you're dealing with a heavy topic. I mean, I always say it's not your grandma's musical. It's not the musicals that we kind of remember from the 50s and 60s. This is heavy topics being presented in a different way.
Yeah, it's a great question. It's not your Oklahoma.
No, it's not.
And for me, now that I have a new career as a nurse and 4 very busy kids, I'm going to spend my time directing shows that just really are important, and I have ties to personally. So it's been heavy. I have a choreographer and assistant director, Sarah Bizek, that is wonderful. She's got some degrees that have given her a lot of input on how we can leave the rehearsal, and she's sending happy things of like, watch this. So I always give myself my ride home after rehearsal to decompress. I think a lot of us do that after any job. But it is, I get home and I can't turn my brain off, and so it's like, watch a episode of Golden Girls.
That's what I do.
I do that too.
I know. And then
it's 30 minutes, and it's great. But
I love They are part of our mental health needs. I love this.
But yeah, it's been heavy, and we check in, and we do the best we can. But it's important to feel those and to connect with those characters because we want it to be real.
Mm-hmm. So I have a question from Sam who says, I saw Dear Evan Hansen on Broadway. I saw that too.
I did too.
Very powerful. It deals with suicide. So how do you think that these sensitive topics presented in this artistic way help with the message? Do you think it helps get people in the seats at the theater? Do you think just bringing it to people in a creative way helps?
I think so. I think it's like any movie or TV. It's like, oh, I see that person that is going through the same thing as I am. And again, I've used this word a couple of times today, but just normalizing our everyday struggles, whether it's depression or suicidal ideations. There is that little thing in our brain, and some of us just have a hard time turning it off. So Dear Evan Hansen is an amazing piece of artistry, and I too saw it on Broadway. I love it.
Yeah.
But Next to Normal is similar. It's dealing with the pain we have inside and what we do to release that.
Well, and maybe that's what you're saying. It normalizes it. Yeah. We're now we're not showing you Oklahoma
Nope.
or The Music Man. We're going to present you in this reality,
Very real. Yeah.
reality and life. And if they're making a musical about it, something tells me this is affecting lots and lots of people. So Juan has a question, Lauren, and this is very broad, but maybe you can hone in on something here. But are there protocols to prevent mental illness in the U.S.? And maybe you can just
protocols. That's an interesting word. There are a lot, and every day there are more and more evidence-based treatments. In terms of protocols, schools are developing programs. States are working on statewide comprehensive behavioral health services. Our nation has SAMHSA, which focuses on dropping down funding for behavioral health programs across our country. So yes, there is structure, but what we've struggled with again is, will people feel comfortable accessing those services? And now that people are, we found that there is more demand than there is supply. And so we've really quickly shifted the number of people who are willing to seek help and want to seek help quite faster than we've been able to grow and add additional professionals. And so I think that has become a challenge for people as well. We want to encourage people to use their EAPs, reach out to friends and family, peer groups. There's a lot of ways, but don't just hold it in.
Right. Anything to add to that, Tiffany? Just your thoughts?
Yeah, it is alarming the individuals that need to seek help. And for me, and I work in a health system, it's easier. It's readily available. But there's others that, maybe they don't speak English well. Maybe they don't have a car to get to where they need
barriers.
to go.
We talk about the barriers.
And so we just really need to get the community more involved.
Meet people where they're at, figure out what the barriers are, try to come up with solutions for the barriers.
Yep.
John wants just to know in general what your thoughts are, Tiffany, and Lauren, you can jump in, just about having mental health in pop culture in general. I mean, we see it, again, it goes back to the normalizing, seeing it on our social media feeds. It's incorporated into even the sitcoms that we see and movies. And how do you think that's moved the needle, if you will?
Yeah, well, I think that anytime you're talking about something, it's not going to be a detriment, but we don't want to, what's the word I want to use? It's not like that it's cool. We don't want to make it like, trivial, right? Like this is an actual issue and that people live with every single day. So I'm glad that it's out there and we're normalizing it, and Broadway musicals dramatize things to an effect, but it is very real and there's some heaviness to it, and so I just don't want it to get out of hand, I guess.
No, and that's a really good point. I see what you're saying, and to where it's just kind of now part of the background and we don't really pay attention to it. And this is kind of the new thing because COVID, now everybody's talking about it, but then eventually things start to kind of be swept under the rug again.
Right, the pendulum, right? It's not life does not look like the Golden Girls, even though that is very
We wish.
calming.
We wish.
But some of us grew up watching that on TV and thinking, well, my life might not look like that now, but that must be what real life looks like. And so that it's really about being real with ourselves. And so if these conversations help us realize that there is no perfect world.
The three of us will not be retiring together in Miami.
I mean, we can do whatever we want to do, but we will not all, it won't quite look like the Golden Girls. We'll have a blast.
Yeah,
but it might not look like that
Right.
because we'll have more ups and downs and
that's okay.
that emotion we'd be sharing. And so we'd probably be pretty mentally healthy because we would be having those conversations and not pretending like we're just fine and then going to our rooms and crying by ourselves. So
that's a really
community. Belonging.
We have a question from one of our viewers. Just again, we wanted to pop up the information about where you can check out Next to Normal. So I want to put that out. So there are the dates, and then you just go to thebarnplayers.org. Is that right, Tiffany?
Yeah, there should be like an Eventbrite link to purchase tickets for any of the 8 performances, and or show up. You know, if you're not sure ahead of time. You know, unless we're sold out.
Show up
be able to.
And what's the name of it? Because you're right. I just call it the old King Louis
I know,
building.
I
That's
still
what it is in my mind.
The Johnson County Arts and Heritage Center. I know, it's a mouthful. There's like a really cool Johnson County museum
It
in
is
there
gorgeous.
for kids.
And they've like kept the structure of the building still.
It's
It looks
really,
just like
really
when I was
cool.
9 and I would go to skating parties. That's exactly what it looked like. It was amazing. So check out, you're right, it's a special space. And Next to Normal is a really, really special message. Before I let you two go, my two moms, we've talked about it's Mental Health Awareness Month. Kids are back in school. Just for the parents of kids and still in school age, what advice? Give us some advice on just kind of how you're talking to your kids and how you're helping them kind of get back into the swing of things and managing some of those tough topics.
Yeah, my kids are very busy. My wife and I are constantly, I think I get in my car and I autopilot to the dance studio. And so for me, that's the best time to check in with them, is when we're in the car, we have 15, 20 minutes, how was your day? And, you know your kids, the weight that they might have on them, and say, are you okay? Do you need to talk about it? You know, just the feeling. So I think even if it's just a car ride, just a check-in.
Lauren?
Yeah, we talked about this. I so believe in the power of communication and just making yourself, making it so your kids can tell you anything, no matter how embarrassing it is, and making sure that they know that's okay, and then exposing them. I mean, I share a lot with my kids about what we see and what we do, so that they know there's places to get help should they or their friends ever need that. And so I plan on taking my kids to see the show. And I know there's a lot of parents that may not do that. Certainly want to make sure it's age appropriate. Mine are a little older, but I like to expose to things like that and then have discussions to process, because it almost always comes out, oh my gosh, that happened to my friend last week. And so again, it's just another way to hopefully connect people.
That's a good light bulb moment for me. It was like, present them with a story, a book, a movie, a moment, and then let that conversation just start to take over.
We don't want to present them only with the Golden Girls.
Correct, correct. Exactly. Life is not totally golden. Joellen wants to know, are there any light moments in the production?
Light as in
a little comic relief every now and then?
Oh, yeah. I mean, the show, the writers won a Pulitzer for it. Because of all that it enlightens, but there's definitely humor in it. It is. She made a good point. My daughter's 10, and she's gone to theater shows since she was 18 months old. But this isn't one I will be taking her to at 10. There's some language because it's just so real. So I would think 13, 14, then you can have the discussion of possibly bringing them.
Okay, that was my next question. So, good to know. This has been a great conversation, ladies. But before we get your final thoughts, I want to ask you about this first. I wanted to ask our guests about if they're feeling stressed, if you're feeling stressed. Researchers at Dumont Fort University in England suggested that we should reach for music instead of food. Study shows that some powerful music for distressing includes the music of Eminem, Amy Winehouse, and Linkin Park. That's according to the women who took part in this research. They said listening to these artists helped to release feelings of anger or sadness that they normally would soothe with food. The music cut their reliance on snacks in half. So why music works to help people eat less is not totally known, but experts suggest it could be linked to the release of happy hormones like dopamine and serotonin. I mean, music is all good stuff. How scientific is that?
Well, I'm certainly not the scientific expert on that, but I could think of a lot of brain processes around our amygdala and different things that would get activated that would cause music to be a nice alternative to any type of fight or flight response, or just a way to kind of get that out.
Right.
You hear about athletes talking about getting some of that out on the field, take it out on the ball. I hear that in baseball behind the as I'm cheering for my son. And so, I think if music can be that outlet, it is. And I think music for a long time has caused, great music causes good internal emotion. Causes emotion. And it's not all happy emotion. It is sometimes sad emotion, and we have to get that out. Again, we can't hold it in
I've
all
listened
the
to
time.
songs on the way to work, and I'll be in tears by the time I hit the parking garage, just because I'm thinking of something that just triggered an emotion about something or someone. And then I'm blaring the music, and it's getting me pumped up for a big, busy day. So as somebody who's putting together musicals, what are your thoughts?
I love music. I've always loved music. I think so. Like on the way to a baseball game, my son might be a little anxious, and we're putting on, pumping it up. Trying to get him excited, trying to forget about the anxiety that he has inside. But yeah, I love music. I think at Strawberry Hill we have music therapy as one of the coping skills we're teaching our patients. But Next to Normal, you're going to hear, it's a modern rock musical is how they describe it. So we have a band, I'm not even going to say an orchestra, we have a band that plays. Our guitarist, Bill Wood, he worked with me 10 years ago when I did this, and he's playing it again, and it's fantastic. So I think even if you're just into music, Next to Normal is a great.
I don't know if you could go to any musical and not walk away feeling like I took something from that.
Oh, absolutely.
Whether you feel good, it's left you with a great message, and this is going to do both. And Joellen says, please bring these two guests back.
Oh.
So you'll have to come back. Do you promise?
Promise.
Okay, okay. So I do want to get your final thoughts before we go. And just, Tiffany, what do you want us to know?
I want people to start normalizing mental health. I want people to be able to say, me too, and I'm not okay, and that's okay. It's okay that I'm not okay. And, during the pandemic, I had a group of girlfriends that I've known since I was very young. And we met at Thanksgiving, and then pandemic happened, and we do Marco Polo, and we do it often, and we're constantly checking in with each other. And these are women that they know me, and they know my ups and downs, and I have no problem telling them about my ups and downs. And I have that, but not everyone does have that. And so I just want people to feel comfortable with talking about the struggles that they are going through, and not just the big things, like the little things, like, oh my God, the drop-off line this morning at school it just really just put my day in a damper. Let's talk about it.
Right. And that's reality. What I love about you is that you're still on the stage, and you're fulfilling two dreams, and you're also caring for our mental health patients, and it seems like you're right where you need to be on the stage and down at Strawberry Hill, and you must be thrilled to have her
I couldn't be more proud of Tiffany and all she does, both at Strawberry Hill and in her artistic life. It's really phenomenal what she's doing. I think my final thought would really be focusing on just making sure that everyone knows that because we can't see it doesn't mean it's not real. And so have those conversations really early with your kids. Broken bones have cast, you can see them. Explain how mental health looks and feels, because there is not necessarily an x-ray that's going to pick that up. And I really think ultimately that's the key to breaking the stigma long-term over the generations, is training people early to know that this is just one other aspect of our healthcare, like our A1C that we manage, and it has to start really
one of the
early.
Most important, because it kind of goes all the way down.
A lot of research to show that mental health can drive a significantly improved healthcare outcomes, including surgical recovery. So
Always good to have you. You'll be back, though. Joellen says you've got to come back. So
Okay.
we have to do it. We'll
you
do it
must
for
do it.
Joellen.
All right,
Yes.
Dr. Hawkins, you'll be back. You're always
Yeah,
back.
I'll be back.
Yeah.
No, I think it's important. I think we've seen certainly an immense spike in anxiety from children all the way through adults since the pandemic. Hopefully that is overall improving. We know that the U.S. Preventive Services Health Task Force has recently recommended that providers screen children 8 to 18 for anxiety. So it is very poignant and present in our everyday lives. It's important to understand that and be on the lookout for it. But also, hopefully it will get better as we are getting out of this pandemic lifestyle where kids can return to school. We know there was a heightened amount of that anxiety in general because of that. So keeping kids in school is extremely important, and doing the due diligence and looking for those types of cues that may signal anxiety is extremely important as well. So all this good work, and just keep talking about it and keep those conversations open.
All right, Dr. Hawkinson, thank you so much. Coming up at 10 a.m. on All Things Heart, we have the story of a family in crisis, and what's happening to them could happen to any family anywhere in America. Alexis Del Cid joins us now with a preview of, Alexis, what is simply a tough but necessary episode, right?
It sure is, Jess. We're going to devote the entire episode today to the fentanyl crisis, and there's a family here in the Kansas City area that is in the thick of it. They have bravely let us into their world as a teenage girl battles an horrific addiction to street drugs laced with fentanyl. And there are 2 lives at stake here because she's also pregnant.
It takes all my problems away. It takes my pain away. I don't really worry about anything.
And you could just hear it in her voice. She doesn't want to be here. She's doing everything she can to get healthy. She's pregnant, addicted to an horrific drug that could be fatal every time she takes it. Doctors say it's like playing Russian roulette. So coming up on All Things Heart at 10 a.m., you're going to hear the full story of the teenager. The addiction psychiatrist who runs the opioid addiction clinic here at the health system will join us, along with a cardiologist here at the health system as well. We will be sharing with you resources that can help you or a loved one if they're struggling with addiction. So bring all your questions. We will answer them live. That's all coming up at 10 a.m.
Alexis, thank you so much. I'm so glad you're doing this story. We will be watching. And thank you so much for being with us today. Don't forget, you can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. Go out, make it a great Thursday, and we'll see you back here tomorrow at 8 a.m. Coming up tomorrow on the Morning Medical Update, more than 2/3 of women diagnosed with breast cancer will undergo breast reconstruction.
For me, I just want as normal as possible.
I'm Jessica Lovell. While there are many options for reconstruction, we learn the benefits of using a woman's own tissue from her tummy. It's microsurgery and hours long. Why this patient says it's worth it on the next Morning Medical Update, Friday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.